Hey everyone, I'm Vanessa, a certified yoga teacher as well as a wellness and purpose coach, and today I will be your host. This video is brought to you by Guardian Malaysia, dedicated to helping you live your healthiest life. Have you guys ever wondered, how do I nurture my well-being? Well, you're not alone, and Guardian is here to support you on your journey to a better health. Today we're going to be diving into a topic that is not just about looking great, but also feeling great. Weight management. And joining us, we have Dr. Gayethri, a highly respected consultant, internal medicine physician. Dr. Gayethri completed her Bachelor of Medicine and Surgery at 𝐻𝐸𝐹 University and is a member of the Royal College of Physicians, Ireland. We're so honored to have her here, to just share with us her insights and experiences on internal medicine. So glad to have you here, Dr. Gayethri. Really excited to get chatting. Today we're going to be covering topics like the common misconception of weight loss, and then also sharing with you guys some practical tips on how we can help you start on your weight management journey. And of course, last but not least, incorporating healthy eating habits as well as exercises into our busy lifestyle. So without further ado, let's get started. Okay, Dr. Gayethri.
Yes.
Truly now, I'm going to welcome you on set. Are you ready?
Yes, I am.
Are we going to loosen up a little bit?
Yeah, quite loose already, but yeah.
Okay, quite loose already. Okay, we're going to further warm up. So we're actually present here for our audience. We have a game prepared for you, okay?
All right.
Next to you actually have a whiteboard and a marker pen.
Okay.
And we're going to start with a game called Express Doodle.
Okay.
Okay?
All right.
Express meaning you only get 5 seconds. Doctor only gets 5 seconds.
Okay.
But you're going to draw the first thing that comes to mind when I mention these words.
All
Okay?
right.
Okay, so you can grab your whiteboard, you can grab your marker. We've got 5 seconds for doctor.
Okay.
And the first word being soft drinks.
Soft drink.
Let's go. 5, 4, 3, 2, 1. Woo! What is this? Wow, God, not bad lah. Come, let's show the audience your soft drink.
Fanta.
Not bad lah. She can draw some bottle and all. The fizziness is not there, but it's okay. Very nice. Good job.
All right.
Okay.
Okay.
Second one. Are you ready?
Yes, I am.
5 seconds. Okay. This one is a big part of our lifestyle. Sometimes maybe you would tell people not so much anymore, but second word. Fast food. What's the first thing that comes into your mind? Okay, I'll give you some time.
Food.
Okay, 5, 4, 3, 2, 1. Okay.
French fries.
Very good lah, doctor's drawing. Honestly, me, the first thing that came into my mind was like a burger. I don't know why.
Yeah, that too actually came to my mind first, but I thought it was a bit too
Complicated.
intricate to draw. So yeah.
But you did great. That's awesome. Okay, last one.
Yep.
Ready? Wah, this one macam a bit susah lah. Okay.
Throw it on.
But maybe not for you. Okay. Lack of sleep.
Lack of sleep.
Okay, ready? Give a bit more time, 5, 4, 3, 2, 1. Oh my God, this is
Being
so
a
funny.
doctor.
That is actually so funny. I love that.
All right. Thank you.
That's so true, isn't it?
Yes.
So I think all the doctors will agree. Actually, my doctor friends also lah. How do you guys deal?
We are trained for that, isn't it?
Trained
So,
for
yeah.
all your life. Okay. Thank you so much for
Thank
playing
you.
along. That was
Thank you.
so fun.
That was fun, actually. That was truly fun.
Amazing.
Yeah.
And you draw so well. Okay, so we're going to go straight into our topic for today,
All right.
okay?
Yep.
So my first question to you is, when we talk about weight loss, in my head, what I'm thinking is, when I want to lose weight, it's trying to fit into that jeans and that pants that I want to wear. And I think that's generally like what people think about. What do you have to say about that? Is that it, or is there more to it?
Actually, rather than weight loss, I would like to use the term weight management. Yeah, because weight loss is just targeted at pounds and kgs, and I think it's way beyond that.
Yeah.
So let's talk about weight management instead of just weight loss.
Okay, what's the difference? What's the biggest difference between weight loss and weight management?
All right, weight management is beyond just weight loss. Yeah, it's about achieving your ideal weight and being able to maintain it. Yes. So I am not against any, concept, society concept of beauty, of numbers and shape. That's not it. But for my patients, I would always come up with a plan, like a weight management plan of how much of weight they need to lose according to their medical conditions, according to how much of time they can put aside for exercise, and how much they be able to cope with a dietary plan.
Okay, so when we talk about weight management, basically we're talking about achieving a healthy body weight.
Yes, that's right.
But I'm curious, as Malaysians, where do we rank, or how do we do in terms of our general health in Malaysia?
You'll be surprised, in Southeast Asia, we are number one in obesity.
In obesity? Oh my goodness, that is so crazy. So I guess when we talk about obesity and like how we're ranking at the top in Southeast Asia, it has a lot to do with our food and lifestyle. But when I think about it and I'm wondering, does obesity always look like we're looking heavy, or is there more to it?
Obesity, it's definitely more than that. It's just not a body image thing. Yes, it definitely increases risk of type 2 diabetes and even heart disease that can be fatal.
So I guess the differentiation between overweight and obesity there's quite a difference there. What is the boundary in that?
Once again, how you complete it. If you talk about obesity as a clinical term, now how we decide if a patient is obese is using the body mass index. Now that's a very simple way of calculating based on the patient's body weight and height. Yes, a BMI of anything between 18 to 25 is considered normal. 25 to 30 is considered overweight, and of course 30 and above is considered obese. Yes, and that's of course further classified.
So what I'm hearing is a healthy weight loss is important, right?
Yes, most definitely.
And it goes beyond just how we look.
Yes.
What other benefits come with this actually? Beyond the medical benefits, what other benefits come with, just healthy weight loss?
Okay, of course it reduces your risk of certain types of cancer. Yes, especially liver cancer, pancreatic cancer, breast cancer. Your risk of developing all these reduces when obesity is tackled. Besides that, it improves your mood, improves your sleep quality.
And would you say it also affects our mental health?
Most definitely. Obesity is associated to the body image, isn't it? And there's a huge psychological impact, especially when there's obesity in childhood. Yes, when it's followed through even until adulthood, there's a huge emotional and psychological impact. And when obesity is tackled, most definitely, the whole mental health issue associated with it is also tackled.
So self-confidence, just the way we walk,
self-confidence, depression, anxiety, there's a lot associated with it.
Thank you for sharing all of that, Dr. Gayethri. I think one thing that I didn't realize is that mental health is also severely affected, when someone is obese.
Yeah, most definitely.
Yeah. And speaking of, I guess, misconception, what are some myths that, you often encounter whenever you meet your patients or just anyone in general?
Okay, there's one common one that even prevents people from making the first step of trying to lose weight, and that is having to give up all their favorite food. Yeah, and that's not true at all. Yes, you just need to reduce the calories that you take from unhealthy food. Yes, and of course the second thing, that dairy food is fattening. That's not true at all. Yeah, dairy is very rich in essential nutrients. It's rich in calcium, which is good for your bones. It's an important source of protein, which also helps build muscles.
I love dairy lah. Oh my gosh.
Oh, that's good.
Yeah, so that's good to know that it's not, it's not all bad. It's also really good for us.
Yes.
Yeah. And I guess the other one that I know, or like I often hear, is skipping breakfast. Is that a big one as well?
Well, although it may sound logical, yes, but there is no clinically proven benefit of that. Of skipping your breakfast. I think what's the most important thing is mindful eating. Yes.
So now I want to play a game.
All right.
Okay.
Hold it on.
On the topic of misconception,
Okay.
there's so many myths out there. So I'm going to ask you a true or false question. You
Okay.
just let me know if this myth is true or false. Okay?
All right, sure.
All right. The first one. Snacking is a big no-no when you're trying to lose weight. Is that true or false?
False.
False. Okay. Tell
Yes.
us more.
Because snacking, it's not about snacking, it's about what you snack on.
Okay.
If you snack on something healthy like nuts, for example, then It's a great way to keep calories low.
Okay.
Yeah.
So it's what you snack on.
Yes, definitely. It's more how much you eat, how much you snack on, and what you snack on.
Okay.
Yeah.
That's a good one. So what you eat, not about the snacking itself, it's what you're actually consuming. Okay, next
Yes.
one. Certain foods like pineapple and green tea can help you burn fats faster. Is that true or false?
For green tea, unless you're going to climb up the mountain and pluck the green tea yourself, no.
That's so
Yes,
funny.
that's not true. That's all false, actually.
false.
Yeah, there are a lot of concepts. If you take chili, capsicum, celery, pineapple, that's going to aid in weight loss. That's not true. That's not true.
Okay, so that's a false one, guys. So basically, you can eat anything you want, just everything in moderation lah.
Moderation and mindful eating.
Mindful eating.
Yes.
So doctor, just now you mentioned quite a bit about mindful eating.
Yes.
So can you help me understand what is mindful eating and how can we practice it?
All right, so mindful eating is the key. Yes. So it's important to know how your body responds to food. Yes. Now, if you have an understanding of that, you're going to eat mindfully. Yes. You're not going to be overeating. Yes. And then once again, you'll be able to recognize when you're truly hungry, or you're just having a craving, or even you're emotionally just eating.
Right.
Yeah.
So that's probably me lah. She's talking to
No,
me.
I think that happens
emotionally.
to many of us.
Right.
Yeah, it's a common thing.
Right.
It's a very common thing to happen.
Okay, so mindful eating, basically just becoming aware of what is it our body is actually needing versus what it's craving.
Exactly.
Okay,
Exactly.
got it.
Yes.
Doctor, speaking of some tips that you shared just now, what about exercise? I need to know this part. How important is it in terms of, weight management?
Talking about weight management, I think we've already spoken about the dietary aspect of it. Now, speaking about the exercise part of it, it's important that we commit to do cardio exercises like swimming, cycling, running, and jogging for at least 20 minutes a day. 3 times a week. But of course, if you could do more than 20 minutes, that could definitely aid in weight loss.
And for those who are considering health supplements and also detox teas, do you have any advice for how to navigate this area?
Well, there are some supplements that can aid in weight loss by increasing your metabolism. Yes. But if anyone's going to come up and tell you, look, this is one magic pill where you could lose weight without dieting, without any exercise, then trust me, there's no such that one magic pill. That doesn't exist. Yes. So it's important not to get carried away with such things. And I think the key thing is when you're going to take any sort of supplement is to consult your doctor or your pharmacist who goes through all the ingredients and make sure that it's safe for you.
Okay, that's
Yeah.
a really good tip. No magic pill, guys.
Yes,
okay?
definitely not.
Okay. We've touched on so many things today, but I have to ask you one last question before I let you go, okay? If you have just one advice for our audiences who are watching today, what would it be before they go?
All right. I think the main thing is to understand that weight loss, weight management, weight loss, it's not a sprint. It's a journey. It's a journey. Yes. And it's very important not to be hard on yourself and take small baby steps one day at a time and just celebrate small victories. Yes.
Okay, so I think I've dug enough of Dr. Gayethri's brain. Thank you so much for sharing your insights with us.
You're most welcome.
Yeah, I think I really walked away with so many beautiful tips and tricks. You're walking away with anything today, I hope it's remembering that mindful eating is very important. Eat what your body needs, not what it's craving for. Stay active, stay hydrated, and finally, I really love this one. Balance and consistency is the key because guys, it's a journey. It's not a sprint. So take it one step at a time. And if you guys are needing any advice on weight management, please get your advice from an expert physician as well as a guardian pharmacist. And until then, we'll see you next time. Bye.